Hey, good afternoon, everyone. Annie, if you can just confirm that you can hear me before I start going.
Yep, you're good.
Okay, great. All right. Thank you, everyone, for joining us this afternoon. This is our Healthy Town application technical assistance. Many of you have probably joined us for this before. I will do just a brief overview of the application, give you some tips and tricks on completing your application successfully, and then we will have plenty of time for Q&A at the end of the session. Okay, so just before we get started, just a quick thank you to our sponsors, funders, and partners. Without them, we would not be able to do the work that we do. And I guess I should really start by saying, in case we have not had the pleasure of meeting, I'm Julie DeSimone. I am the Director of Community Health here at the Quality Institute, and I oversee our Mayor's Wellness Campaign. So hopefully everyone on the call is familiar with our Mayor's Wellness Campaign. It's our statewide community health initiative. It is in partnership with the New Jersey State League of Municipalities, and we provide mayors and community leaders with tools, strategies, and technical assistance to champion healthy living and improve the overall health of your communities. And the Mayor's Wellness Campaign gives you mayors, your staff, and volunteers the platform and tools needed to make your communities a healthier place to live, work, and play. Okay, so just, before we get into the application, just some of the benefits to becoming a healthy town. It really is a great opportunity, especially for those of you who have already achieved this designation, this. It's a great opportunity for you to be recognized for all of the great work that you're doing throughout the year. We recognize communities in which mayors have made healthy lifestyles a top priority and are actively engaged with all of your members in your community through inclusive, evidence-based health and wellness programming, policies, and just a real culture of health in your community. Healthy Town designations are a great way to honor your teams, and this is achieved, as you know, through a competitive process that happens annually. So this is an application that you do have to submit every year to be redesignated. And so it's also a great way to really challenge your Mayor's Wellness Campaign team to either maintain or hopefully improve upon your designation from last year, which is really ultimately going to strengthen all of your programming. It is also a nice way to utilize the designation to engage residents in the success of your program. I think as this program continues to grow, we increasingly hear more people throughout the state really recognizing this designation and understanding that if their town is designated as a healthy town, that means something. And we also always like to encourage a little bit of friendly competition with neighbors. So that always is a fun way to engage with that as well. You want to make sure that your neighbor doesn't have a higher designation than you. So if you're not familiar, these designations are not given to a set number of Mayor's Wellness Campaign towns, but rather to all of the towns who apply and meet the high standards defined in each year's Healthy Town rubric. So since I've been here, we have grown the number of healthy towns every single year. So there's not like there can only be 10 healthy towns and you have to be able to get one of those spots. We are happy to designate all of the towns out there that are able to demonstrate that they're doing this important work to the standards that we are laying out in the rubric. And we'll talk a little bit more about the rubric later on. There's 3 different levels. So there's Healthy Town, which is our gold designation, Healthy Town to Watch, which is silver, and then Healthy Town Up and Coming. You don't need to work your way up through the ranks necessarily. So if this is your first year applying, it is absolutely possible that you can achieve a silver designation or even a gold designation. And you don't have to go in order. And that being said, it also means that just because you received one designation last year does not mean that you'll receive that same designation this year. We really do take each individual application separately, and we really look at what you've accomplished in that last calendar year to determine your designation. So just a little bit more detail on kind of how we differentiate between the 3 designations. For the Healthy Town, these are communities that have really well-established and engaged Mayor's Wellness Campaign committees that are using research and local data, including social determinants of health, to assess the health of their communities. We also are looking for communities that collaborate with local partners to implement programming to reach their health goals that have been established for the year. And we want to see that you're successfully evaluating program and have sustainability plans in place. A healthy town to watch are communities that are on their way to becoming a healthy town, and you've made a commitment to improving the health and wellness of your community. Along with key stakeholders, they've started to incorporate local data into programming and have identified ways to evaluate their programs. And then a healthy town up and coming is a community that's made the decision to focus on health and wellness in their community, and you've started inviting important stakeholders to the table and offering healthy activities and education for your residents. And so, again, you don't have to work your way through the ranks of these designations, but those are kind of just the broad categories that we're looking at. And I do want to note this year, the scoring ranges have been updated to reflect changes in the number of rubric categories. So again, we'll look at the rubric a little bit more later, but I just want to point that out that because we have added more categories to the rubric, the actual numbers have changed. And so again, I'm really just saying that for those of you who have received designations in the past, to just make sure that you're taking a look at the rubric, that you're really thinking about where you fall in those categories, and that's going to give you a good sense of what your score will look like and if you're kind of tipping over into those higher categories. Okay, so now we're just going to walk through the application. So I'm going to pull that up for you. There's my family. There we go. Okay. Just get the slide straight here for you. Okay. Show you that at the same time. Sorry, everyone, just give me 1 second. Okay, we'll just go from here. So as you hopefully have seen, if you've already taken a look at this, the application is up and open on our website. As a reminder, filling out these fields is the only way to apply for the application. We don't want you submitting an attachment or a Word document. You have to put everything into these fields. That being said, right here, you'll find the link where you can open a Word document. I do recommend filling out the answers to all of these questions on the Word document, saving it to your computer, and then when you are completely finished, coming over to the website, copying and pasting everything in and hitting submit. Truth be told, it is not the best system on our website for this kind of like application process. So, sometimes towns will say, oh, I saved it and now it's not there. I do not recommend using the website as a place to store your work. Really work off of this Word document. That's why we started providing that. And it really is going to save you the headache of, calling me on that Friday when it's due and saying, I've lost all my work. I don't know where it is, because honestly, there's just not a lot we can do on the back end of the website. So please make sure that you are saving this in a Word document so that you can mitigate any of those issues. I just want to see. Oh, I'm seeing in the website that maybe our document is not updated. We will make sure to get that done. I thought that was taken. It might still be labeled as 2023. I will make sure that it is updated by the end of today if that's the case. Thank you for bringing that to my attention. Okay, so we're just going to run through this really quickly. The beginning is really just basic demographic information. Please, when you are filling out these email and phone number fields that we're asking for, I know that sometimes you're putting in a mayor's email who might not really be accessing that email. This is how we're going to notify you of your award or let you know that there are issues with your application, if there are any. So please make sure that you're putting an email. We do need a mayor's email on file. And then so for that secondary contact, make sure that that's somebody who knows about the application. If it's not yourself, depending on who's submitting this, but make sure that we have accurate contact information so that we can let you know what's going on, especially if there is an issue with your application when we go to review them. Similarly, with your municipal address, put your mailing address in. If you do receive a designation, we will end up sending you banners and plaques, and it's just a lot easier if everything is entered correctly up front. For your last date of your pledge of participation, you receive an email copy every time your mayor signs the pledge, so you should have that on file. If you do need help with that, you can ask, but I really recommend that when you're getting those confirmation emails that you're keeping track of those things. For social media information, we do use this information to tag you, to notify your residents that you've received some of these designations. So, put them in if you utilize them. If you don't, just put NA so that we know that it wasn't just an oversight. Okay, so that's kind of the basics. The first thing that we're asking for, and this again is familiar to a lot of you, we are really looking for information on how you are completing your local needs assessment to get information about what health challenges your town is facing. In this part of the process, we want you to really describe how is your committee, your town, your health department, I know everyone's set up a little bit differently, but how are you collecting data to understand the needs of your community? And what tools are you using to gather this data? So just provide us with a little bit of background on how you're doing that and what it looks like. If you don't do that, you can just write that you don't do it. You don't have to, sometimes that's just not part of your process. And obviously that will be reflected in the scoring, but that's really the information that we're looking for there. In the second question, based on that data, we're looking for what the three top areas of health and wellness are. So, these two questions should definitely be connected. We want to see that you are choosing that you chose these three issues based on that data that you collected. Then we're really asking questions about your Mayor's Wellness Campaign Committee. Again, if you don't have one, you can write that you don't have one. You don't necessarily need to provide any ancillary information there. We want to know if you have a formal committee, who serves on it, and also is it reflective of the demographics of your community? That's something that we really are encouraging towns to start thinking about. Do the people sitting around the table making decisions reflect the members of your community? And so again, if they don't, that's okay. It's something that we want you to work towards, but we're just looking for some information on that. This section here is really where you're going to give us the bulk of your information about your programming. So I will open this up quickly. This is an upload, so you are going to fill this spreadsheet out. We are looking for your top 10 programs. So I'll, full disclosure, I'm only reading information about 10 programs. So choose your 10. Really, there's no reason to provide any more than the first 10 fields here, because I'm not going to read beyond that. We really want to hear about your kind of best and brightest programming. And then we really need you to fill in all of these sections for each program. So thinking about, and we have, we want to know what the program is, what is the health goal of the program? I've noticed that there's some of these responses can tend to be kind of all over the place. So just to kind of clarify, what we're looking for here in the health goal of the program is what part of health are you looking to address through your program? So just for a basic example, if you are providing a mental health first aid training, the goal of that program would be education around mental health. So don't overcomplicate it. We're really just looking to understand what were you trying to achieve with this program. What are the social determinants of health that are addressed? If you go back to the application, we do give you some information on what that means. I've provided that information in the past. If you have questions, you can ask me, but this does come from a category of pretty specific options. Who was your target population? Who did you partner with to accomplish this activity? Was there a cost to participate? If you tracked attendance, what did that look like? And what was your evaluation method? So you might just write, we're going to ask more about evaluation methods towards the end of the application, but here you might just write survey, you might write we only tracked attendance. So just letting us know what you looked at to determine if this was a successful program. So again, this is going to be the bulk of the information that we're receiving about your programming. In this next question, we're just asking how your Mayor's Wellness Campaign activities are funded. That one's pretty basic. Here, this is new. Last year, we wanted to understand how is your Mayor's Wellness Campaign addressing specific health needs of your underserved residents in your community? And then we kind of give you a little bit of information about what underserved means. People have answered this question with, we don't have underserved portions of our community. I know that we have a lot of affluent communities in New Jersey. That does not, there are no towns in this state that don't have an underserved population. So, I want to really have you thinking about it. And again, if you're not addressing it in any specific way, that's okay. But we want you to start thinking about that going forward. Then we're asking you which programs are based off of the Mayor's Wellness Campaign Toolbook, our handbook, or another resource provided to you by the Quality Institute. So we're just really trying to understand, are you using our resources to drive your programming? So it might be from a webinar that you received. It might be that you attended our panel presentation at the league and you kind of adopted a program that you heard about from another community. But we're really just trying to gauge where you are getting your ideas from and if our resources are being utilized throughout your program. If you have a number of how many people participated, you can provide that here. Now we're kind of getting into the evaluation piece. So describe how you evaluated the effectiveness of your programs and activities. Again, if you didn't, you can just write NA, but really we want you to be working towards this if you're not already doing it. We want you to be able to show the impact of all of these programs that you're running. So we want to know how you looked at whether your programs were successful or not. And then through that process, what feedback did you actually receive from those evaluations, and kind of giving us a little bit more detail about what that process looked like. If you want to attach surveys or other evaluations tools that you use, you can drop those files here for us so that we can take a look at that. That's helpful for us to understand how you're evaluating programs, but it's also something that we can share with other communities if they're struggling in this area. So we always like to see what you're doing. Then we're going to talk about future goals of your Mayor's Wellness Campaign. I really encourage you to be as specific as you possibly can in these areas. So, what areas of health and wellness are you going to focus on? Do you have program plans for 2025? Try to be specific here. It really helps us to understand what you're going to be working for in the new year. Then we just want to hear about kind of any successful programs that you think other towns might be interested in hearing about. Likely you probably describe them in your Excel sheet, but it just helps us to kind of just flag them here if there's anything that you were really happy with how it turned out this year. And then we just ask that you give us some feedback if there's anything that you want to see from us. You can always write NA here if you don't have any suggestions, but it's just another way for us to kind of garner some feedback from everyone about how we can better support the work that you're doing. And then here we give you the opportunity to attach 5 documents that you think are going to be useful to supplementing your application. Again, a Word document with more description is not necessarily what we're looking for here. We've given you the character maximums here for, to kind of give you a sense of how much information we want on each of these questions. So stick to those character limits for these questions. But here we love to see photos. If you want to send us a flyer, if you've created videos, this is a great place to do that. And that is the bulk of the application. So I'm going to kind of switch over to the rubric here just to kind of give you a sense. And I'm not going to go through this piece by piece, but just drawing your attention to it so that you can really understand how we're scoring these applications. So as I mentioned earlier, we are only looking for information in this application that happened in 2024. So it's an annual designation. We don't want to necessarily learn about programs that were run in 2022 or programs that you ran when you started the program. This is really specific to this calendar year. And so that's just a reminder. Again, here's the updated scores that you can take a look at. And so, just to be very transparent about it, this rubric is how we score these applications. I sit down with this rubric and I look at your application and I walk through each of these questions, and based on the information that you gave us, we're going to put you in, we'll give you a score for each of these categories. So I encourage you to do this with your application before you submit it. If you walk through the questions and as you're trying to put yourself in these categories and you see that you're kind of lacking in some spots, then maybe that's a place in your application that you can strengthen it. And just remember that, I only have the information that you provide in the application to use to score these, to score these categories. So just keep that in mind, that you might know a lot about what the process looked like, but I'm only going to have the information that's provided in the application. So being really clear, concise, is going to help you out when we're looking at this scoring. So again, I'm not going to walk you through all of these. I just kind of like to talk through the process, and you can really see very clearly how we are scoring these applications. And we like to really think that it's as objective as possible, and that's why we put this out on the website and really use this as a planning tool. Okay. All right, moving all my screens around here for you. Okay, so as a reminder, we will be accepting applications until January 17th at 5 p.m. You don't have to wait until January 17th at 5 p.m. to submit them. Please feel free to submit them earlier. It's less stress for you. And we will not be accepting any late applications. So please make sure, to try to get it in before that 5 o'clock time. You never want to have a computer issue or find out that you couldn't submit that. I know that can be stressful, and we want to make sure that doesn't happen to anyone. So here's just a list of all of our Healthy Town awardees from last year. So again, you see the bronze designation here and the Healthy Town Up and Coming, our silver for Healthy Town to Watch, and then our gold Healthy Town awardees. So if you're not up here for this year, hopefully you will be next year, and we hope that everyone continues to apply who has already received a designation. So just as a reminder of what benefits you'll have access to once you successfully receive your designation, all towns will receive a plaque and a banner to help you to share your accomplishments with your residents. And again, to kind of encourage that culture of health in communities. We want this to be something that residents recognize and really value in their communities. Each year, we also publish a press release highlighting all of our winners, and we provide towns with that outdoor banner and plaque for your communities. We'll also highlight you in our newsletter, our social media, and as well as in an article in the League of Municipalities magazine. And again, this not only helps you to give credit to your staff and volunteers, but really makes community members more aware of your program and helps to increase engagement. One of the things that we've hear as a constant challenge for Mayor's Wellness Campaign communities is how do we get people out to the events? And I think the more that you're able to really highlight the work that you're doing, the more you're going to get people interested in coming out to those events that you put so much work into. Okay, so just a couple of reminders. Please use that Word document. I will make sure that it's updated on the website right after this. I apologize for that. And so I can't tell you, every single year I have somebody who will call me at, on the due date at 4:59 and say, I thought my application was saved and it's not there. And, like I said, our website is just not really set up for that. And so that's why we do provide that documentation for you to work on the Word doc. Please work off of that Word document. I feel terrible when people put all that work into the application and then they have to redo it or aren't able to submit. That being said, note the character limits when you're copying and pasting those back over. Make sure you're checking them. The box will only take as many characters as it allows. So I don't want important information to get cut off for you. And again, those character limits are meant to be helpful. It's kind of to give you a sense of how much information are we looking for on each given topic. Your responses should only address 2024 programming. So again, only things that happened between January of 2024 and December of 2024. If you can include your town name in those updated files, the uploaded files that you're submitting, that is really helpful. Last year we had over 80 applications, so we're really sifting through a lot of these documents and attachments. And so if you can just put your town name in those, it really helps us to be able to manage that on the back end. I know this might seem like silly advice, but make sure you're answering the questions. We only need the information we're asking for. The more concise and clear your answers are, the easier it is for us to evaluate them. For those of you who maybe are familiar with like the grant application process, it's kind of the same thing. As the reader, the easier it is for me to identify the information that I'm looking for, the more likely I'm going to be able to really address, the scores that we want to give you, and use that rubric. I'm going to use that rubric as I read through each application. And so if you feel like you can answer the questions in a way that helps me to understand them as it relates to the rubric, the better your application is going to be. And again, don't forget, January 17th at 5 p.m. is the deadline. All right. I know we have some questions already. I'm going to start with those, but if you have your questions, please feel free to start typing those into the chat or into the chat box or the question and answer box. Are there grant opportunities that healthy towns have access to? So not specifically through us. I know we are trying to increase our access to funding, as hopefully many of you know, but it does not kind of any town that's part of the Mayor's Wellness Campaign is eligible for any of our grant opportunities currently, but that's not to say that it wouldn't change in the future. All right, let me just back up here. I will make sure that link to the social determinants of health is up there. It looks like that got skipped as well. So I will update that link and make sure that that's on the website as well. Robert, thanks for asking that. I did notice that wasn't there. Let's click the public. Matt, I understand your concern there regarding, is it possible to put the banner for 2 years? It always looks like we have the year. I got it. It looks like you're behind. Unfortunately, because we need the year to end before we can, give that designation, we are going to just stick with the 1 year. Otherwise, those banners get a little bit cumbersome to look at as well. But I get it. But I think, it kind of helps you to say, and we're working on it again this year too. Yes, a recording of the email will be sent out as well as the slides, and they'll all be available on the website. Any other questions? Is it only programs sponsored by the township, or can we include entities like the library programs? This is a great question. You get to decide what is included in your Mayor's Wellness Campaign. Now the kind of caveat is that we would hope that, to use your example, Christine, that the library would have been included in your Mayor's Wellness Campaign discussions, that maybe, you would have looped them in, maybe put your Mayor's Wellness Campaign logo on the flyers for the information that's going out. If you have that section on your website where people can go and see all the Mayor's Wellness Campaign activities, incorporating your library programmings into those. So the short answer is yes, you of course can include, other entities' activities. The goal would be to really incorporate those all into your Mayor's Wellness Campaign throughout the year. But again, it's up to you and your communities to determine what kind of works for your Mayor's Wellness Campaign and what's going to be included in that. We recognize that towns are set up differently, departments work together differently, so we are not overly prescriptive on that. We want to hear what basically, all things health and wellness that are being offered in your community. And, that being said, it's always a little, it's kind of obvious to us when something is like truly a Mayor's Wellness Campaign program versus just something that is being included because it looked at health and wellness. But again, it really depends on how your community is set up and what your Mayor's Wellness Campaign looks like. But happy to answer more specific questions on that offline as well. Any other questions? Okay, if you think of any, I just have, one more slide that I'll run through and I can answer those. Otherwise, okay. Okay, so there has been a gap between health educators for my town and no work was done for 2024. Should my town apply this year? I think it would be challenging to submit a successful application if you haven't run any programs. So, again, it's not something that you have to do every single year. You don't have to, just because you received a designation last year does not mean that you are required to apply this year. You can still apply next year. So listen, we understand things ebb and flow. Sometimes it has to do with staff turnover. Sometimes it has to do with elected officials, changing priorities, or, a new mayor coming in and just maybe not having the capacity to focus there. So, we do see that often where towns might, take a year off and come back. So again, I'm happy to kind of, if you want to reach out, we can kind of talk about your individual situation, and I can give you a more in-depth answer. But if you don't have specific programming for 2024, it's going to be hard to fill out that application successfully. You absolutely can partner with another town if you're a small town. We have communities do that. The Chathams are a good example of that. So we're not overly prescriptive in what your Mayor's Wellness campaign is supposed to look like. We just want to see that you're able to check some of those boxes around program development that we're looking for. Any other questions? Okay. Just a couple of upcoming activities that I wanted to highlight quickly. The Sign the Pledge is still ongoing. Another thing that a lot of people still don't, or seem to have they still have some confusion around, is the pledge is also annual. We ask that mayors sign that each year. So, and you do get points for that in your application. So, if your mayor has not signed, if you yourself as the mayor, or if you're working with a mayor that has not signed the 2024 pledge, please make sure to do that. It's an easy way to get full credit in one of those categories. And it just helps us make sure that we know who is really active in the programming. Our statewide survey will be emailed out shortly if you haven't done that already. So make sure that you are filling that out before the end of the year. By filling out that survey and signing the pledge, your town will be entered into the incentive drawing twice. You get 2 entries if you do both of those things, and you can win up to $1,000 of funding towards your programming. Plus it helps us to get some feedback about, what supports you need from us. We also will have on January 14th, we will be having a webinar to launch our community hub. You may have heard, some of you are already, I know, participating in this. We did kind of a little bit of a tester cohort. And so we will be launching that in January. I really encourage everybody to attend. It's a platform for you to be able to interact with each other, share resources, ask questions, get ideas. And so far we've had really great feedback. So we're really looking to incorporate more of you into that program. So we hope you'll join us there. The application is due on the 17th at 5 p.m. as I mentioned. We'll also be offering our mental health first aid trainings. These are free trainings to help individuals in your community to identify a mental health crisis, support somebody who's in that crisis, and then get them connected to resources. You've probably heard me say before, I really feel like this is something that is, as many people as you can get trained in your community, the better. And so keep an eye out for emails that will go out for those, but all of these are up on our website as well. And we hope that you'll join us for one of those, and please share those with anyone in your community who you think might benefit from them. It is really an excellent training, and the more people that we can get trained in this, the stronger our communities will be around mental health. Sappy, the survey is not on our website. It's on the hub. So if you're not included in that at the moment, you don't have access to it that way. But like I said, we'll be sending out the survey a few more times before the end of the year. So we'll make sure that you get that. Any other questions before we sign off here? Let's see. Okay. If that changes, you all know where to find me. Please reach out. I'm happy to answer any individual questions about your application and support you as best we can. Send me an email, or we can schedule a call to talk about your applications. And we really look forward to hearing about all of the great work that you guys have been up to this year. Thanks for joining us this afternoon, and we look forward to your applications.